Healthcare. Heathrow Healthcare is an innovative pharmaceutical company. Our journey began in 1993. We have 30 years of excellence and 36 state-of-art manufacturing facilities. Heathrow Healthcare has 300 plus products in portfolio and presence in 126 plus countries. It has 21,000 employees globally, and Heathrow Healthcare is the largest closely held pharmaceutical company in India. Heathrow Healthcare is among the largest manufacturers of ARV, APIs, and FDFs in the world and has Asia's largest API manufacturing facility at SEZ Complex, Visakhapatnam, Andhra Pradesh. Vitro Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties, pioneering in quality and innovation, and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are Darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, Heathrow Healthcare, the pioneers in antivirals, offered oseltamivir, favipiravir, and remdesivir to the patient, because of which in August 2020, Heathrow Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar, Rational Approach to Viral Respiratory Tract Infection. As I told you, we have got moderator Dr. N. Sridhar with us. Dr. N. Sridhar is practicing since last 20 years. Sir is Professor, Apollo Hospital, Apollo Institute of Medical Science and Research, Director, Neo BBC Hospital, Hyderabad, Treasurer Secretary, Twin Cities Branch, 2122, 2324, Joint National Coordinator, CIAP 2024-2025, Presidential Action Plan, Secretary, PATS 2025-26, Medical Legal Expert. So major achievements have been 7 national and 1 international publication. Additional Chief Organizing Secretary, Pedicon 2025. Organizing Secretary, APPA Pedicon 2016. Former Trade in Charge for all conferences since 2016. Vaidya Ratna Award in 2023 from Dr. B.C. Roy, Mother Farm. Welcome, Dr. Sridhar, and over.
Thank you. Yeah, thank you for your kind introduction. And before, yeah, able to see, sir?
Yes.
Yeah,
You're sharing, sir?
yeah, I'm shared already.
No,
Okay.
because I did are my slides. I will stop sharing and you share your slides.
Okay.
Now your slides I can see.
Yeah, okay.
And sir, after you finish the slides, I'll come to the panel questions which I have got.
Yeah, sure. Anytime.
Okay,
So
sir.
before going into the topic of empiric use of oseltamivir in flu management, let me tell somewhat about the introduction of the influenza virus, which is commonly known as flu and is an infectious disease caused by influenza virus. And symptoms may be range from severe to often include mild to severe, often include fever, running nose, sore throat, and muscle pain, headache, and coughing and fatigue. So what happens is in we here all the symptoms of viral infections, similar presentation will be there. So we have to able to differentiate the severity of the infection, and also as early as possible we have to diagnosis. And previously we used to take 7 days, 8 days time for the diagnosis, but now we have a lovely kits where within 24 hours we can get the diagnostics criteria. If you feel that if you because empiric use of oseltamivir in flu management is a very interesting topic. Why? Because if you use this oseltamivir, which is the beautiful drug, and that patient will be relieved of hospitalization, relieved of cost expenses, relieved of the complications, everything. So in these, mainly the symptoms begin 1 or 4 days days after exposure to the virus and last about 2 to 8 days. So diarrhea, vomiting can occur also in these conditions, and may some cases may progress to pneumonia, and but from the virus of subsequent and we can think of subsequent bacterial infections also. And other complications include acute respiratory tract distress syndrome and meningitis, encephalitis, and problems such as asthma and cardiovascular disease may worsen the condition of these things. So always we should remember whenever talk of influenza virus, there are 4 types: A, B, C, D, and A is the main. B and A are the most of the epidemics caused in the scenarios, and influenza A and B virus circulate in humans and cause seasonal epidemics and transmitted by the droplet infection. And frequent hand washing and covering one's mouth and nose when coughing and sneezing reduce definitely the transmission, as does wearing a mask. Annual vaccination definitely prevent the influenza. And this is the basic introduction, sir. So the thing is, the contents are healthcare challenges in monsoon and diagnosis, influenza, its complications, and clinical evidence of sildenafil, and guideline recommendations for empiric use of oseltamivir. So whenever we think of, there are some always a differential diagnosis when you keep with this influenza-like illness, H1N1, what we are dealing with, and a severe acute respiratory illness and COVID-19. But COVID-19 we can definitely because in we got experienced in 2020 and 2021 where a lot of COVID cases are there, but anosmia, the loss of smell, loss of taste, and GI symptoms will be predominating in the COVID-19. So that can be excluded when we think of influenza. But influenza-like illness and acute respiratory illness definitely are challenging to differentiate with H1N1. And here is the data in our from the book of vaccination purple book in 2022, which was released by the IAP, and year-wise number of cases. You can see how many cases are registering in each year and how many deaths are there. In 2017, there are 38,811 cases and 2,270 cases deaths are there. The mortality is definitely is worrying for the parents and the society. So where we have to think of seasonal influenza has to be deal with a emergency situation, and we have to deal with a clinical acumen so that we can give a with a shortage of treatment. And if you start the oseltamivir, which is a lovely drug, and we can shorten the hospitalization, shorten the treatment expenses, and shorten the complications. And here is the overview of the influenza in India. Here again you can see the green color where 2019 cases are registered, these many cases, and mortality 1218 deaths are there. And as earlier said, influenza A causes frequent epidemics due to minor antigenic variation, and periodic pandemics due to major antigenic variation. And local epidemics are caused by influenza B. So most of the cases are influenza A, and 30 to 40% will be influenza B. In few cases, influenza C viruses can infect human and swine, and influenza type C infections generally cause a mild respiratory illness and are not thought of that causing epidemics. The currently circulating in humans are subtype H1N1 and H3N2, where we are having a vaccine for these, and so yearly has to be given. Below 6 years has to be given yearly, and in adults also now we are advising to give, because of the epidemics and endemics, we are advising them to take the vaccine in adults also, so that they can prevent the complications and influenza illness. And how does this transmit of flu virus? As I said, droplet infection, it can spread up to about 6 feet away. Flu virus are mainly spread from people with flu cough, sneeze, or talk. These droplets can land in the mouths and nose of the people who are nearby and possibly be inhaled to the lungs. People should stay away from the affected person. We don't know, but by seeing the person, the sick is there, the child, the patient is coughing or not, we can make out that. So stay home. If sick, really, we have to advise our relations, our students, our children. Let them stay in the house for these 3 4 days so that it will not spread to the others. It is also important to wash hands often with soap and water. Most healthy adults may be able to infect other people beginning one day before symptoms develop and up to 5 to 7 days after becoming sick. So, the children, in some cases, children may pass the virus for longer than 7 days. If normally 5 to 7 days, if we take care of the things, if you isolate ourselves, or if you advise isolation as a doctor to the patient, if that is happens, the transmission of viral infection will be lessened. But in some children, it may pass the virus longer than the 7 days. So here, as earlier said, influenza-like illness and severe acute respiratory illness, COVID-19, this is the differentiation chart where all the fever, myalgia, cough, lack of energy, sore throat, breathlessness, and headache maybe or may not. So, uh, in present viral infection of H1N1, where the breathlessness will be there in H1N1, and loss of smell, loss of taste, diarrhea will not be there. And to exclude COVID-19, loss of smell, loss of taste, and diarrhea will be there. And in some cases, if it is H1N1, headache will be present in these things. But whereas influenza-like illness and severe acute respiratory illness may or may not be present. But headache body pains will be there. We have to, in this condition, I want to tell, adenovirus and respiratory syncytial virus, both the virus has to be excluded whenever the differential diagnosis think of. And in adenovirus, it is a multi-system involvement will be there, whereas H1N1 mostly predominant respiratory infection, respiratory tract. So in adeno, it will affect that. But respiratory syncytial virus also affects the respiratory system, but here the severity will not be there. And the emergency signs of flu sickness in children and adults will go ahead with the children. The fast breathing or trouble breathing will be there, cyanosis will be there, not drinking enough fluids because of this cyanosis and fast breathing, not waking up or interacting because the hypoxia itself makes child will be dull and toxic, where will not be having interaction or waking up and being so irritable that the child doesn't want to be held. And flu-like symptoms improve, but then return with fever and worse cough. Fever with a rash in some cases, we can see fever with a rash. In addition to the signs above, whenever the case is the child is severe, infant or child is severe, when these signs are there, definitely we have to take to the higher center and get the treatment. So one is important is basic being unable to eat and has trouble breathing with retractions and intercostal and subcostal and infraclavicular and clavicular retractions are there, has no tears when crying because of the dehydration, significantly fewer wet diapers than normal. Because of the dehydration, child will not be able to pass the urine also. Those, so no sweating, no tears, no wet diapers will be there. These are all the dangerous signs where we have to take immediately. The child has to be admitted. So for the people who are attending this today's presentation, let us talk about the complications. Why this flu is that much important? See, it can lead to bronchitis, it can lead to ASOM and some cases of CSOM, and worsening exists diseases like asthma and COPD. Whenever there is comorbid conditions, we say. So whenever the asthma or COPD are there, this will flare up the influenza virus will definitely flare up the comorbid conditions also, and ARDS and landing in some cases, untreated cases and severity of cases landing in pneumonia, and few may land in death. So, how to treat the influenza virus treat? The mainly the best supportive and largely supportive and consists of bed rest, increased fluid consumption, cough suppressant if child is having severe cough, and antibiotic analgesics such as paracetamol has to be given, and NSAIDs for fever and malaria. If fever associated with myalgia, fever with severe headache, unable to very toxic, very child is unable to move, then we can use some other NSAIDs. And most patients with influenza cover in 3 days. However, the malaise may persist for weeks. The severe cases may require IV hydration and also supportive measures. And there are category A, B, C, where for category A we give the bed rest and oral consumption and thing, but B and C definitely will deal with the things. And what is the great drug since this 1 decade we are seeing treatment of antiviral drugs? The best drug is neuraminidase inhibitor, where it blocks the viral neuraminidase enzyme, which is critical in releasing virions from the infected host cells. So what happens? The infected host cells will release the virions. The virions will affect the healthy cell and get again infected, and that causes again infective cell releasing more virions to the affect the other cells. So these drugs are active against both the influenza and B. The best is oseltamivir and other drug is zanamivir. And other group of like what neuraminidase inhibitors, there is adamantines, where it is M2 ion channel blocker, but only active against influenza A virus. The drug is amantadine. This used to be used in 8 to 9 years back, but now since oseltamivir is the best drug which is acting more on A and B, so we are using this oseltamivir, where we can definitely give a healthy child to the parents. And oseltamivir is a potent and selective inhibitor of neuraminidase enzyme of influenza virus A and B, it's a prodrug which is converted to active form oseltamivir carboxylate in the liver, inhibits influenza virus replication and pathogenicity, and prevents further spread of infection. It is effective in all against all the strains of influenza A and B, and this is the mechanism of action. The chart you can see the budding virus where the receptor contains salicylic acid will be there that will release the virion, and they release new virions, and there will be continued viral replication in these things. And if you use a neuraminidase inhibitor, what happens is it the virion will not be spread to it halts the viral replication, viral pathogenicity. It decreases the new healthy cell affected by the virion. So the virion release will be lessened. In, and it's a great to say it's the first oral neuraminidase inhibitor, and it is approved more than 100 countries, FDA and CDC, American Academy of Pediatrics, which had approved this. And the dosage schedule, please remember, whenever you feel, just you have to keep this chart in your OPD so that immediately you can see the weight of the child and write the dose, not even to calculate. But if you are interested in the calculation, the best is 0.25 ml per kg per dose has to be given, and in ml, or else 3 mg per kg per twice daily should be given. And always the 5 ml syrup will be containing about 60 mg. So as that has to be remembered. So a 10 kgs child comes to your clinic, the dosage schedule is 2.5 ml BD has to be given, or if you calculate 30 mg, that comes again 2.5 ml. So that is the easy way to calculate. I calculate 0.25 ml per kg per dose so that it will be easy for the us in a busy practice, so that we can write very fast the dosage of oseltamivir. And the benefits of empiric use in the early use of oseltamivir is oseltamivir treatment of influenza-like illness reduces LRT, lower respiratory tract complications, antibiotic use, and hospitalization, as earlier said. There are so much data in from 3,564 subjects, means a huge number, sir. You can say, and the all are enrolled with influenza-like illness, and in patients with influenza and oseltamivir treatment reduce antibiotic use, influenza-related complications, and hospitalizations by 59%. You can imagine how much benefit to the patient. Giving a antibiotic resistance, you are preventing it. In hospitalization bills, you are preventing. The complications, you are preventing. So antibiotic use, you are preventing. So this much benefit if you diagnose early in your clinic, the child is having these symptoms, and the report, the diagnostics will take much time, like 24 to 48 hours. Use the simple CBP. If it is a viral, that means the total count will be very less. So immediately, if the total count is normal or more than 10,000, I think I feel not to start, but go for the investigations of influenza A and B card method, or some other. But whereas if really total count is less 3,000, 4,000, definitely after once the sample is sent to the influenza screening, respiratory panel screening, definitely you start this oseltamivir. So, reducing occurrence and severity of pneumonia to H1N1 by early oseltamivir administration. A retrospective medical chart review of 442 patients was conducted, and median time from symptom onset to oseltamivir administration is 5 days. Subjects were divided less than 2 days, 3 to 7 days, 8 to 14 days, more than 14 days. So, in these things, where happens, you can see the both the probability of the any severity of pneumonia and probability of severe pneumonia increasing gradually with the time from symptom onset to oseltamivir administration. You can see this chart, time from symptom onset and probably for pneumonia occurrence. So even when it administered 48 hours after symptom onset, oseltamivir showed considerable potential for reducing pneumonia. So the guideline recommendation, empiric treatment is strongly recommended. Treatment should be started as soon as possible. Laboratory confirmation of influenza virus infection not necessary for the initiation of treatment. Negative laboratory test doesn't exclude the diagnosis in all the patients. Therefore, early use definitely will help the patient. If higher risk individuals has been exposed to a patient with influenza, consider present to treatment with oseltamivir. Here, I want to put a word. If the uh, two siblings are there, elder child had influenza and younger child is having mild running nose, it doesn't have fever, but still, as a prophylactic drug, has to be given the same day, same for 10 days. If the treatment part is there, twice a day for 5 days. If a prophylactic dose has to be given for a child, it has to be given daily once for 10 days. So again, the dose is point 2 point, the point 25 ml per kg per day. So if a 10 kgs, again I'm citing an example, a round figure 10 kgs child, 2.5 ml means 2.25 ml, 2.5 ml daily once for 10 days has to be given. Because if the child is there with the affected child, what happens is there is an incubation period where child can be affected, and we have a proven case of influenza. So don't hesitate to start the prophylactic drug for the other child, where other child will not land in these complications and diagnostic of influenza virus. So an early empirical supportive therapy and monitoring is more important. Give empiric antimicrobials to kill the likely pathogens causing severe recruitment, and always secondary bacterial infections has to be keep in mind, so that we can start the antibiotic if child is not improving. And empirical antibiotic treatment should be based on the clinical diagnosis, and empiric therapy, including a neuroamidase inhibitor for treatment of influenza when there is a local circulation or other risk factors, if including travel history or exposure to animal influenza virus. This has to be definitely keep in mind. And in adults with community-acquired pneumonia who test positive for influenza, should the treatment regimen include antibiotics? We recommend. Yes, definitely the recommendation is anti-influenza treatment also to be prescribed for adults with CAP who test positive for the influenza. So there's a strong recommendation and moderate quality of evidence, but several observation studies suggests that treatment with oseltamivir is associated with reduced risk of death in patients with hospitalized for a CAP who test positive for influenza virus. And treatment within 2 days of onset of symptoms or hospitalization may result in best outcomes. So the summary is, the proper diagnosis can and early treatment can prevent flu complications before. If you start within 48 hours, there will be a lot of improvement in the child and they will not land in complication. Empiric use of oseltamivir reduces lower tract complications, hospitalizations, and antibiotic use. And WHO, American Thoracic Society, and Ministry of Health and Family Welfare recommends empiric use of oseltamivir. So uh, as a practitioner, as I see most of the cases, I'm in a hospital, so I have seen a lot of cases where we have to give oseltamivir as an early presumptive drug, so that if the child is really toxic, sick, with running nose, with cough, with severe pneumonia-like symptoms, and toxicity with body pains, headache, don't hesitate to start oseltamivir. But one suggestion is send the sample for the CBP and other respiratory panel things, because RSV, adenovirus, and this H1N1, these all present in a similar way. So better to send the respiratory panel, and that will come within 24 hours. In meantime, you get the CBP. If you see the total count is less, just you can start the oseltamivir, where the child will improve very fast. Thank you. Thank you for this. So
Sir, I'll share the questions.
yeah, sure, sir. Sure,
Yeah.
sure, sure. Yeah. So, as
Sure, sir.
earlier said,
Okay.
definitely
Yeah.
my experience with Saltamir is very good.
Yes,
We used
exactly,
to,
sir.
yeah, we used
You have
to
always
give,
been saying this.
as earlier said,
Yes,
uh,
yes.
yeah,
So, do you think the
my
incidence of viral infections increased possibly after COVID?
Yes, yes, has definitely the viral infection has increased day by day because the population is increasing, the
Exactly.
infections criteria are increasing, and the diagnostic criteria are coming forward
Improving.
to
Yes, yes,
catch
yes.
up the early diagnosis.
Correct,
And
correct.
as a clinicians, we have to be thorough with the clinical knowledge so that we have to early
Exactly.
diagnosis. And you know very well the patients have started window shopping. They come today to you, and if 2 days within 48 hours child doesn't improve, they may land into some other clinic. So
Correct, correct.
we whenever we see a case, we have to see with 100% concentration and confidence,
Absolutely.
so that we have to diagnose the viral infection. And possible reasons are only because of the crowded community and
Correct,
low
correct.
socioeconomic status, and all this. We say we are a developing country, so we do have all these facilities like malnutrition and low
Yeah,
socioeconomic. So and anemia and
yeah.
these things, all the
Add to
comorbid
that, add to
conditions
that.
definitely will increase the
And sir,
incidence of
to
viral
add,
infection.
yeah, generally, how soon the child comes to pediatrician?
Sir, most of the cases, because every parent is now at least somewhat in the
Correct, correct.
literature is increased day by day.
Increase, yeah.
Yeah. So the parents will Google the things and see the things and or discuss with their colleagues and peer groups and start some paracetamol or antihistaminic like that. So always the most of the cases, if really they are worried about their child, they bring on the first day and to second day. But most of
Yes,
the cases land in third day, fourth day, or fifth day to the hospital, sir. They trial because
correct.
they have to consultation will be
GP
there,
also, the
medicines
local
cost will be
GP.
there, and because of the economical conditions also, they may
Absolutely.
bring the child for after 3 days or 4 days. But we shouldn't make it late
Yes, yes,
by
yes.
diagnosing. We have to be, if they come on first day or fourth day or fifth day, take the clinical history and start the oseltamivir, where if really it requires, we have to start. We
Yeah,
shouldn't take go behind for the expenses of the syrup.
yeah. Actually, the first day to us, maybe third day of the infection. I mean,
Yes,
it's possible.
yes,
I mean, you have already answered. They should have started
yes,
empirically. Yes, you
yes,
already answered. I don't want to waste
yeah.
it. So, besides early start, any other factor on which oseltamivir response depends? Maybe asthma, maybe other
Yes,
comorbid
yes. We
conditions.
have we have other comorbid conditions. We have
Yes,
beautiful cases also. Last time we have done that, and one is asthma.
correct.
And in asthma, what happens is the bronchoconstriction will be more with the influenza illness.
Correct.
Already, child is a known
Oh,
case of bronchial asthma. Whenever there will be a very much like a synergetic effect, I can say.
okay.
The patient who is having influenza like illness or H1N1,
Uh,
they stimulate the bronchial constriction,
I
and again
see.
they land
Okay.
in more exacerbation of the bronchial
Asthma.
asthma. And also, we have seen some cases of nephrotic syndrome in comorbid conditions
I
and
see.
other connective tissue disorders. These are all related to autoimmune disorders, sir. So, most of the autoimmune disorders or these things will be exacerbation will be there whenever the viral infection, not only influenza, sir, any viral
Any
infection,
violence.
these will increase the conditions of the asthma or connective tissue disorder or nephrotic, all the autoimmune
All.
disorders, sir.
Sir, if this influenza, just for example, the influenza infection is not treated, the risk of getting fungal infection or staphylococcal pneumonia will be very high, I suppose.
Very high, sir, because as earlier said, you have seen there are chance of secondary bacterial infections are there.
Correct.
And few things, any doctor starts some antibiotic. It doesn't mean that it's wrong. We can
No,
start,
no,
sir,
absolutely
because
correct.
see,
Absolutely.
absolutely, some people may feel that, Arey, it's a viral infection. How can you start antibiotic? No, 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 it's not like that.
It's
That
clinician judgment,
there
yes.
are always the clinician is the
Absolutely,
best one to
absolute,
decide what
absolute.
to start. Yeah, we
Correct.
will start oseltamivir as a as a the second line drug, because
Correct.
the normal things in our practice we have to think of the common scenarios. So
Absolute.
we have to think of respiratory tract infections, pharyngitis or lower respiratory tract infections. We have to start the antibiotic. Then
Antibiotics.
see, if child is having simple running nose and mild cough, we can wait for the second day, third day, fourth day.
Absolutely. Correct,
But
correct.
really child is toxic, dull,
You can't wait.
is required some
Very correct.
category B and C management, means we have to go ahead with the antibiotic
Everything,
and the
everything possible.
and oseltamivir.
Yes, correct. Very correct, sir. And how long you generally administer oseltamivir?
Sir,
5 days.
as earlier said, oseltamivir should be given twice a day for 5 days, and a prophylactic management
10
daily once for 10 days.
You feel, sir, giving prophylactically will prevent the spread of infection?
Sure, sir, sure.
Yes.
Because the neuroamidase enzyme
Correct, correct,
inhibitor itself stops the release of virions, and it will not affect the healthy cell. The replication and pathogenicity will be decreased at the
yes,
stage one, so that the if you
yes.
start as early as oseltamivir, definitely child will improve very fast.
And if you give oseltamivir, anyway, the chances of getting admitted is also less because
Yeah,
then
less.
you're
And
controlling infection.
as we say, the three things important: hospitalization, you can reduce the amount, and antibiotic use, you can reduce the antibiotic resistance, AMR, and third is most important, preventing the complications.
Correct,
So
correct.
everything, say in other way, with 500 rupees of oseltamivir, we are saving thousands of
Absolutely,
rupees.
absolutely.
So that should be counseled for the
Correct, correct,
parent.
correct.
And see, I can't say that all the cases of 100 cases, if you start a with maybe 10 or 15 or 20 cases may land in secondary bacterial infections and
Yes,
have the
yes, yes,
other
quite right.
complications. But most of the cases, if total count is less than 5,000, 4,000, 3,000, you start the oseltamivir, you will have a better result.
Correct, correct. Correct. And of course, we have discussed this question. Like,
Yes,
in your experience, sir, how it is tolerated? Any major
sir.
side effect,
Sir,
contraindication?
till now, it's very well tolerated
Very good.
drug, sir, and it doesn't have any major side effects.
Very good.
We have not seen any, at least we have not seen at least vomitings, or we have not seen any diarrhea. We have
Correct.
not seen any rash. We have not seen anything, sir, any complications with oseltamivir till now.
That's excellent.
If
That's
anything,
excellent.
any cases are registered, just pass on to me so that in the next webinar I can
Great.
answer that question.
Great. I mean, and sir, your overall experience, I will not take your time for the audience, which is
Sir,
very, very important.
really, my experience is oseltamivir is definitely helpful for the child, helpful for the parents, helpful for the community, and also society. See, diagnosing a viral infection early and starting oseltamivir and and decreasing the pathogens and replication of the virions. So I feel oseltamivir is a beautiful drug. In my practice, I do use oseltamivir whenever required, and I request all the doctors who are listening to today's webinar, please diagnose early, because you can reduce thousands of rupees,
Yes,
especially
yes,
for
yes,
the
right.
patients, parents, and social status and everything. You can decrease them, and really it will be very much helpful for the treatment part. And also, doctor, you can get a very good name once you start single drug and paracetamol. Along with paracetamol, if you start these two, you will definitely get a good name, and they will bless you, and you will get a good wishes to you also.
Very correct. Very well said, sir. The cost of complication will be very high, and
Very high, very
yes.
high.
Thank you so much, sir. Thanks for taking time and sharing your experience. I'm sure the audience has benefited out of it. You have always said that you believed in oseltamivir. You have got excellent experience. You always said that.
Yes.
And thanks for sharing this once again with the audience. Thank you.
Thank you.
Kamal, you want to add
Thank you,
anything?
Sanjana. Thank you, Payal.
Thanks, Sanjana.
Thank you so much, sir. It was a wonderful session. I'm sure the entire panel or the attendees might have, taken benefit from those.
Yes.
Thank you so much sir, for your valuable
Thank
time.
you.
Thank you, everyone attending.
I'm very sorry for 10 minutes.
It's
I
okay,
was
sir. It's
late.
okay. It's okay.
Okay.
Perfectly fine, sir.
Yeah.
Perfectly fine.